Welcome to the South First, where we narrate the other half of India's story. I am Chetna Belgare. We all know that we spend a large proportion of our waking life working. Work influences our health for the positive through a sense of identity, purpose, and income for the negative, affecting mental and physical health. After 2 years of getting used to working in pandemic-induced isolation and often stretching work hours, but in the comfort of one's home, employees are now in a limbo, wondering if they will be able to cope with the reality of office life. Several companies are now insisting their employees get back to offices. There are already issues of burnout due to work, and then they're talking about quiet quitting at work, moonlighting, various new terminologies that have been introduced to the jargons of the workplace. Today, to discuss this crucial aspect of mental health at workplace, we have with us Dr. Himani Kashyap, clinical psychologist, associate professor of clinical psychology at National Institute of Mental Health and Neurosciences, NIMHANS in Bengaluru. She has also worked as senior neuropsychologist at the Victorian Rehabilitation Centre in Australia. Her expertise includes work with individuals with anxiety, depression, grief, and personality disorders. Her research work includes development of a new tool to assess thinking and novel therapeutic interventions for cognitive and emotional problems. She's also working on training psychotherapists to work with grief and loss in the wake of COVID-19. Dr. Himani, we welcome you to the show.
Thank you. Thanks for having me.
Done in 2021, across many companies in India found that 46% of employees had suffered from depression and anxiety. 26% suffered from traumatic stress disorder, post-traumatic stress disorder. Recently, WHO listed new guidelines to be followed at the workplace, asking employers to give more importance to employees' mental health. So, doctor, first of all, tell us what are the common mental health issues or symptoms that people are coming to you for seeking support for?
I think there are a number of people with depression, anxiety, different forms of anxiety, a lot of worry, panic attacks, difficulties with facing people and social situations, etc. But I think a lot more problems arising from grief and loss during the pandemic as well. Apart from that, there are problems with sleep, with eating, people who are coping through eating, through drugs and alcohol, through technology addictions. So a lot of these are problems, I think, that have been on the rise more recently.
Okay. So now that people are returning to workplaces, or indeed, some of them are working on this hybrid mode, what it's called. So what does this mean to them in terms of lifestyle, physical and mental health changes? And is there any kind of, what patterns that you have noticed, or keeping this in mind, like they're getting back to work? So can you give us some suggestions to make this transition easier for both employers and employees?
I think it's been a long time when people have been doing work in a way that has been completely different to the traditional modes of working. So it will certainly take time for both employers and employees to kind of get used to this. What might be helpful is a gradual transition, which many companies seem to be doing, that they work a few days a week and gradually transition back to more hours, etc. But I think we must also be cognizant of the fact that employees, as well as employers, I'm sure, have had to deal with multiple work roles at home as well as in the workplace during this whole time. So it's perhaps a little difficult to shift out of those. People also have been away from social interaction for a very, very long time. And that is certainly likely to have an effect on mental health, because humans are certainly social creatures. That's how we've always been. And it is likely to affect us if there have been long periods of isolation and loneliness.
Okay, doctor. So now, already employees are reporting this high stress of expectations and pressures. And, there is something called as quiet quitting, which is a new terminology which is being spoken about, especially in corporate sectors and, IT companies and those places. So what exactly is this quiet quitting, and what is the role of mental health in quiet quitting?
So, when I was reading about quiet quitting, I found that there are also different connotations of the word and different perspectives to it. So there's the employer's perspective, which is that, people are only doing as much as they're told to do and not more than that. They're not taking on additional responsibilities, which is sort of, from the employer's perspective, like shirking responsibility. But from the employee perspective, it seems to be that that's a way of maintaining healthy boundaries and saying, this is what I'm paid to do, this is all I'm going to do, because I'm not going to work outside of my working hours or give up my life to do my work, sort of thing. But interestingly, there also seem to be terms like quiet hiring and quiet firing, which quiet hiring seems to mean that employers give additional responsibilities to hardworking employees without actually an increase in pay or designation. And quiet firing seems to be that they quietly encourage employees to leave by cutting down on benefits or making things harder for them at the workplace, that sort of thing. So these terms seem to be more recent, in the sense that they've been around for a few years, but they seem to be more often used recently. But it seems like there are multiple perspectives to it. So I don't think there is one single way of looking at it either.
Okay, but have you come across your patients coming up with, clients coming up with these kind of complaints about, I don't want to do this work anymore? So why is this being discussed so much? I'm sure there is something happening inside this workplace or in their minds that they are either, even the employers, for them to give that much of work, or for the employees to feel that we are doing more. So is there a reason? Is COVID, that kind of the 2 years which we have been through, has that got something to do with it?
I think it might have had a lot to do with it. There are a couple of things. I think one is that when people are working from home, it's very difficult to create the same kind of boundaries between work and the rest of one's life, right? One is, and many people have had to perform multiple roles, like I was saying before. There have been people who have had to do childcare, elder care, with no household help, right? No cook, no, etc., etc. So they've had to do all of that while managing their work responsibilities. And there's not often been a way to separate things. Like, you might be at a work meeting, but you might have children crying or whatever, and you do have to sort of shift between the two. And that can place an enormous amount of stress. The shifting between multiple things, we as humans can do for short periods of time. But when we do it over a prolonged period of time, it is likely to affect our ability to, sustain this. Yeah. So it is likely to have an effect on our brain and our minds. So it's possible that, these are ways that employees are finding of managing work and the rest of life. So certainly, throughout that period, they felt like they've done too much. They've been running on 150%. And so they just now want to cut back to, say, 70% and, just keep their head above water. Certainly, it seems to be one of the issues.
So like you said, when we have done something of this multitasking thing, there's another term which is very quite talked about these days, is moonlighting. Especially, this came into spotlight when Wipro sacked its 300 employees for taking up side jobs. I mean, they were doing multiple jobs for multiple companies. So while the debate is on about this ethical issues, is this right, is this wrong, but do you think working for, some people have told us that, they work for about 14 to 16 hours to balance this kind of a job. So do you think doing this, especially when it is something to be kept as a secret, and plus putting in so much of effort, do you think this will actually affect, employees' mental health? I mean, the person's mental health?
I would certainly think so, because there is a reason, work days are about 8 hours long. There have been a series of experiments and, research on what's the best way to work, when are we most productive, etc., etc. And the result of all of that research and experimentation has been that about 8 hours seems to be the amount of time that people can work reasonably well. A little bit here and there is fine. I think we also tend to forget that we as humans are not hardwired to do this. Long ago in our evolutionary past, we would have done a little bit of hunting, gathering, fishing, whatever, and the rest of the time we would have been, zoning out and staring out into the distance. That's what we're actually hardwired to do. We're not hardwired to be on the go all the time. And it is certainly likely to have an effect on one's mental health. If we have to do that, we can do that because we're very resilient. We can do that for short bursts of time. We're equipped for that, but it's going to be very difficult to sustain it over weeks and months and years.
Okay.
I certainly think it might be difficult.
So can you tell us some mental health signs that will tell us that, I need to take a break from work? So are there any signs to look out for?
I think one of the top things would be if I'm dreading to go into work. I think about work and I have this, hollow feeling in the pit of my stomach sort of thing. That's one thing that a lot of people say. It's also things like poor sleep, poor eating, being very withdrawn, not wanting to socialize, not wanting to meet friends, not enjoying things that one would previously have done, and avoiding a lot of things perhaps. And if there is excessive coping, like I said, through eating, drug and alcohol, or excessive screen use, all of those seem to be signs that indicate that perhaps it's time to take a bit of a break.
Okay. So at this workplace, when we come across some kind of, there is this anxiety. So a lot of people say that many times there is this fear, though mental health is still a stigma in our society. So confessing about a mental health is seen as weakness, incapability of that person. Sometimes promotions are not given. Sometimes they may be even fired. So how can this be addressed?
I think, first of all, this has to be a really wide shift because mental health is really no different from physical health. So, if how would employers react if someone had diabetes or hypertension? I feel like mental health needs to be looked at in pretty much the same way, and and then the same kind of flexibility and allowances made for employees with mental health needs, just like they would with physical health problems.
Okay, so there is two questions about the mental. How do we deal with mental health in the office scenario? And then we have some readers' questions for you. So one is, the government of India is planning to launch a national tele mental health program, and NIMHANS has played quite a big role in that. So this is supposed to be enabling many people to seek mental health assistance. So do you think this will help in terms of managing mental health in office or a workplace?
Absolutely. No, absolutely. I think the tele-mental health program is part of the mental health care program in general, and the drive towards making mental health care accessible and affordable, to most people in the population. Because so far, the problem has been that, there was a recent research, the National Mental Health Survey conducted by NIMHANS and many other institutes in the country, which showed that for common mental disorders, which is basically anxiety and depression, the treatment gap is up to 85%. So that means only 15% of people with depression or anxiety actually access treatment. So certainly, I think anything that goes to help with that, particularly something that's easily accessible, would be a real boon.
Okay, so this is my last question to you. Then we go to the reader's question. How do, if you can give us some, tips to remember kind of thing for creating a workspace that is conducive to good mental health?
I think the first thing is just about flexibility. It doesn't have to be anything much greater than that. Like, I don't think people with mental health needs need something vastly different. It just seems, it just boils down to some flexibility with, say, working hours. Some, what shall I say, some flexibility around performance reviews. So not that you do badly at one performance review and you're out, but that you're perhaps given a second and a third chance, because there might be a period when you're not doing so well, but you might certainly pick up at another time. And maybe some allowance to, have consultations with a professional and that sort of thing. And like I said, these are things that employers do anyway for people with physical health needs, right? So if someone had diabetes or hypertension, it's reasonable to expect them to go to a doctor, or to have their meals on time, or to make sure they're taking their medication or something of that sort. So it doesn't need to be vastly different for people with mental health conditions. And the other thing is about leave, I guess, in terms of, most organizations have a good leave allowance. If employees can just be allowed to take the leave that they are entitled to, that seems to make a huge difference. Not, employees don't often want much more than that.
Thank you for that. So here are a few readers' questions which has come out of personal experiences. So one of the readers is asking, if an employee appears to be having a panic attack, what should the person's boss do immediately, or perhaps in the days to come?
So the first thing when someone's having a panic attack is to do what we call grounding techniques, something that can help to anchor them back to the present. So it could simply be having a drink of water, doing some breathing exercises, doing sort of, some mental calculations, or, doing something that is very engaging in the present moment, using something tactile, or, anything of that sort. So a boss who's kind of sensitive to these things, or co-workers even, who can help to engage the person back in a calm, firm way, that's helpful. Over the days to come, panic attacks are not really things that persist, like they're not constant. They occur in bursts. So it doesn't mean that the person needs to not work or anything like that. They might be perfectly capable of coming back to work. But again, they might just need some flexibility in terms of responsibilities, in terms of deadlines and things like that. So it might just be sort of being allowed to step down for a little bit, or, take a bit of a breather, that kind of thing, which is often enough. And certainly a referral to a mental health professional. That seems to be important.
Okay. So the next question is, what would you tell a HR manager or a CEO who would say, look, it's not my job to mingle or interfere with the mental health of my employee. My job is to get the work done and pay. So what would you advise to such people, or such statements made, which is quite common, I would say. Yeah.
Certainly, I think it's not, certainly no one needs to interfere with one's mental health or anything of that sort. But it seems like, this is for betterment in the long run, right? All organizations have understood that taking care of employees' health is important, because that way they retain employees for longer, their employees are likely to keep giving their best, etc. So just like they have provisions for physical health, like I was saying, most organizations have a once a year medical checkup, that sort of thing. It seems like if mental health could just be made parallel to physical health, I think that would just go a long way. It doesn't have to be a whole lot more than that, like I said. And it seems to be that it may not even compromise a person's efficiency too much. If, like I said, if they can just be allowed to step down a little bit, shift to something else, perhaps that's a little less high pressure. And this has always been common. I'm sure that our parents' generation also would have had mental health difficulties, but it just didn't play up that much because there wasn't that much of high pressure. They could be allowed to shift their responsibilities, to do something else for a little bit, and to shift back, etc. So if organizations can just keep that in mind, I think that would go a long way.
So for employers, for employees, can you just give us some tips on how to maintain a healthy workplace environment and this work-life balance, what we call? So, not considering the fact that we are dealing with a post-COVID world. So how do you think we can maintain that balance?
I think simple things, for instance, eating on time, making sure there's some amount of physical exercise, fresh air, that sort of thing, some social interaction, some meeting up with friends, calling, talking to family, that kind of thing. And trying to ensure that there are some compartments, in terms of how work and the rest of life goes on, because that's what it would have been like in an actual office, right? There would have been meetings, there would have been a lunch break, there would have been a cafeteria, there would have been something else. Whereas in working from home, there's just this one desk, and I would have to do everything from this desk. I'd be eating here, I'd be looking after children or whatever, and running meetings, doing everything from the same space, which can get a little too much. So it is important to set some compartments and to try and maintain some boundaries between those, to ensure that there is time for everything that is necessary for a person's health in the long run, I guess.
Thank you, Dr. Himani. This was a very eye-opening interview.
Thank you. Thanks for having me. This was enjoyable for me as well.
Thank you. That is all we have for today. Watch out for our YouTube, Twitter, Insta spaces to know more about our next topic of interview and also ask questions to our next guest. Thank you.